occupational therapist here at Self-Care Therapy, the Lymphedema Management Center. And Angela is our physical therapist, and we're going to explain a little bit about the different phases of treatment and how physical therapy can be incorporated to improve your overall function and your abilities. When you're referred here, typically people are referred for swelling and or wounds, so we can help you with that. That's part of our phase 1 of our treatment. So what we're doing in phase 1 is we're doing the assessment to see what your needs are. We're developing a plan to help treat your wounds and your swelling. And once we get your swelling reduced, which typically is just a couple weeks, then we're moving into phase 2, which is teaching you how to continue this process to keep the swelling reduced. And then you're just coming in for little checkups here. We find checkups and follow-ups are very important to make sure that what you're continuing to do is continuing to work for you and keep the swelling out and keep any potential wounds from forming. And what we have done with our treatments is we've started to incorporate physical therapy quite a bit into them, because we see that there's a lot of needs that people have, whether big or small, and whether maybe they're even before the patient has come into the clinic. Maybe there's some baseline problems that you or someone has had. And so we want to address that while you're here. And there's also some things that Angela can explain next, how physical therapy can actually help your lymphedema success.
So during your phase 1 treatment, that's when you will meet me, and we'll do an assessment and talk about some of the potential issues that you may have, or challenges that you may have with managing your lymphedema. We like to teach you some simple exercises and movements that you can do on your own at home that will help with the management and success of the management of your lymphedema. And as you transition into your compression garments, into your phase 2 lymphedema treatment, then we will really work on increasing your ability to understand how best to manage your lymphedema, how to maintain your flexibility and your strength so that you can continue to be independent and successful in keeping that swelling down and keeping your skin as healthy as possible. After we get a good handle on all of that, if there are any other physical therapy needs, certainly balance issues, gait issues, strength problems, we can always talk about that and address those as we need to, but main focus is to get that lymphedema down and get you healthy. So thank you so much for being here and watching us, and we look forward to helping you in the future.